In Chapter 7, know the differences between primary and secondary or tertiary prevention efforts. Be able to distinguish between those and be able to recognize examples of what those might be. Know which substance use is most prevalent among adolescents and when that is more likely to turn into substance dependence. Be able to identify personal and social influences that tend to promote adolescent alcohol use. And be able to identify the effect that adult supervision and youth programs have on the rates of adolescent drug and alcohol use. For example, know that legal, economic, physical, and social availability of alcohol are environmental influences that may have an impact on adolescent alcohol use. In Chapter 8, be able to identify the components and approach of an intervention. Be able to identify the factors of denial and enabling and how to prevent those factors. Know who the primary client in an intervention is. Know the general education session topics that should be covered. And know what the first session of the family intervention class should include. Know what should be included in the pre-intervention session and know what should be included in the post-intervention session. Know the basic history in Chapter 9 of EAPs, or Employee Assistance Programs, as well as its inclusion in the Big Book, and know about and be able to distinguish between the various types of EAPs, such as broad brush programs, and know what the biggest hurdle to getting employees to participate in EAPs is, which is the fear that use of the program will hinder promotions, cause ridicule, create legal problems, or get someone fired. In Chapter 10, know the chronology of and differences between the Washingtonians, the Oxford Group, and Alcoholics Anonymous, and which came first. Know about the common questions and misconceptions about 12-step programs. Know and understand the 4 psychological processes of a 12-step program, and know what each step is, as well as being able to identify the components of each. For example, if you are asked to identify restitution, you would know that it involves making a list of persons harmed by certain actions, behaviors, or even inaction. And within the article titled The Convergence of Group Psychotherapy and the 12 Steps of AA, know that the use of group treatment has been increasingly recognized as the most therapeutically and economically effective method of reaching out and helping difficult-to-treat patients. In Chapter 11, know the definition of disease as well as the kinds, types, and characteristics of diseases. Know and understand the stages of addiction and be able to distinguish between them. For example, the late stage includes decreased tolerance toward the substance or activity. Know what the DSM is and how it classifies substance abuse, and also know how ASAM defines alcoholism. In Chapter 12, know how alcohol and other drugs generally impact the central nervous system, and know the 4 major classes of drugs and how they impact the central nervous system. For example, that stimulants increase CNS activity by forcing the release of energy before it is needed naturally. Also know how common drugs of abuse affect the central nervous system. And in the rest of this chapter, you should know the following. Know about depression, seasonal affective disorder, bipolar disorders. Again, know the information that this chapter provides regarding those topics. Anxiety disorders, panic attacks. Be able to distinguish between those various disorders. Know which drugs can cause anxiety. Know that the Controlled Substances Act was passed in 1970. Know what the chemical name for alcohol is, and know about the chemical breakdown of alcohol in the human body. In Chapter 13, understand the general trends in drug use and abuse, including emergency department admissions and drug abuse deaths. And also know about the information provided in this chapter about the use of heroin and OxyContin. The topic covered in Chapter 14 is very important, medical treatment. And you should spend some extra time making sure you understand everything in this chapter, as well as the information that we point out in the Medication-Assisted Treatment Counselor book, the MAT Counselor book, and we will cover that right after we cover Chapter 14. So you should begin by knowing the classes and names of medications used in pharmacotherapy, be able to distinguish between those. Understand the treatments for the specified clinical syndromes, such as alcohol withdrawal. Understand the type of person that would be a good candidate for methadone maintenance. Know the meaning of common prescription abbreviations that are listed in this chapter, and know what common prescription medicine does, as well as the common side effects of those medications in treatment. And know about the meaning of common terms and the types of treatment associated with holistic approaches to recovery. Be able to distinguish between them. For example, understand what acupuncture is, understand what hypnotherapy is, and be able to distinguish between the characteristics of each of those approaches. And finally, in this chapter, within the section titled Effects of Drugs on the Body, know that the syndrome known as wet brain is due to nutrient deficiency, and that this chronic brain syndrome is caused by long-term alcohol abuse. While we are on the topic of medical treatment, we are going to switch to the MAT Counselor book, cover a few chapters here, and then we'll go back to the Addiction Professional book. Within Chapter 1 of the MAT Counselor, know the important background information, including the percentage of the population that is vulnerable to opiate addiction. Know the relapse rate of opioid-dependent individuals, and know how methadone affects patients suffering from opiate addiction. Finally, in this chapter, know that short-acting opioids develop rapid tolerance. The next chapter in this book that we will be covering, and that will be on the exam, is Chapter 5, which deals with pharmacology and pharmacotherapy. And this is as it relates to opioids. Know the time it takes methadone to leave the body and the factors that influence that time. Know which medication maintains patients in a lesser degree of physical dependence, and know which medications may cause lethal effects when combined with opioid treatment medications. Know the common side effects associated with opioid replacement medications. And know and be able to distinguish between the stages of pharmacotherapy. For example, if the question asks at what stage of medication-assisted treatment is the goal to eliminate craving, the answer would be stabilization. And then the last chapter that we will cover in the MAT Counselor book in this tutorial is Chapter 6, Screening, Admission Assessment, and Admission. Now there are a number of common components regarding, for example, screening, regardless of the type of client that comes in, or regardless of whether or not it's a methadone maintenance program or medication-assisted treatment program. But if the question is asked in the exam and it wants you to answer specifically that it relates to a medication-assisted treatment program, then the question will say, for example, what is the first opportunity for the medication-assisted treatment provider to establish rapport necessary for a therapeutic alliance in an opioid treatment program, where your answer would be initial screening. So you should know and be able to distinguish between screening, assessment, and admission components of medication-assisted treatment programs. And one of the specific things that you should know in this chapter is that when the initial dose of MAT should be administered once a diagnosis is made, and that patients are at a critical phase until their body achieves a steady state. All right, so we're going to return now to the Addiction Professional book. Pick up at chapter 15, which relates to fetal alcohol syndrome, hepatitis, AIDS, HIV, and communicable diseases topics. Know what FAS is, as well as its consequences. Understand the differences between universal, selective, and indicated prevention strategies for FAS. Know the characteristics of the hepatitis virus. And know and understand the correlation between alcohol abuse and the increased incidence of high-risk sexual behaviors and contracting HIV. And then starting with the article on page 235, titled Alcohol and Hepatitis C, through the end of this chapter, there are a number of things that you should know. We are going to give you the questions that you should know and be able to answer by reading the rest of this chapter. You should write these questions down and be able to answer them. How can alcohol consumption exacerbate HCV infection and the associated liver damage? HCV infection is becoming a leading cause of what? There are several things that will be correct, including cirrhosis and liver failure. In 1993, what qualifier was added to diagnose AIDS? What is HIV? Know what the complete name is, and what does it cause? Alcohol use can increase susceptibility to which infections that can occur as a complication of AIDS? What is a disease common to needle users caused by endotoxins that produces symptoms similar to a very bad case of influenza? And finally, know that most communicable diseases will start slowly but then rage through the most susceptible groups.